Okay, I'd like to call this meeting to order. Michelle, roll call, please.
Charles.
Here.
Klett.
Here.
Larson.
Here.
Miller.
Here.
Sanchez. Here. Wong.
Here.
Jacobs.
Here.
All members are present.
Could I get an approval of the agenda, please?
So moved.
All in favor say aye.
Aye.
Man,
Aye.
this echo thing is weird. I wonder if I could sing now. Okay, we are at the item 2A, emergency health use of all seen it in the paper. This is unusual times. It calls for, I think, solutions. And Lori Luther from the city is here to talk to us about the Emergency Operations Center and the plan for the use of Aldridge. So are you going to use the microphone up there? So you're on.
Jeff?
I'm sorry, yeah, John?
Lowe. Yeah, in order to abide by anyone who may perceive me as having any type of conflict of interest in this potential community crisis situation due to my service as being a board member of the Beloit Health System, I'm going to recuse myself from this conversation and the vote on this item. So I'm going to drop off, and if Michelle can just let me know when we get to the next item on the agenda, it'd be appreciated.
Yes, I will.
Thank you, John.
Yeah, thanks.
Thank you very much. Before I begin, I really want to applaud your entire staff for how they have been handling this health crisis. And I can speak to you on that both as a parent of 4 children, all in Beloit schools. One of them's Beloit College, but the other 3 are in Beloit School District schools. And my spouse is a teacher at the high school. And on behalf of the city during this crisis, for the election, your staff has been amazing. They have helped us facilitate the drive-through voting. They've provided translation services. The list goes on and on. It has truly been exemplary, and I deeply appreciate it. Thank you for holding this special meeting before a holiday weekend to consider this request. I am here not only as your city manager, but also as the incident commander for the City of Beloit Emergency Operations Center, otherwise referred to as an EOC. We opened our EOC on March 13th on behalf of our entire community so that we could prepare and respond to the global health pandemic. I want to assure you before I begin that in both my professional and my personal capacity, I would never ask the school district to do something, anything, that would put our community's children or your staff at risk. But given that this is a global health pandemic, we began preliminary planning for what is called an alternative care facility. You'll see the acronym ACF. And that started several weeks ago under the leadership of Deputy Chief Murray, who is present this evening. He is our safety and medical officer for the city and also serving in our EOC. And he's led this effort in coordination with Emergency Management Director for Beloit Health System, Jody Moyer, who I believe is on the phone. Jody is the Beloit Hospital's liaison directly to the city's Emergency Operations Center. She physically comes in to our lightly staffed EOC. We have some who call in, and we're coordinating our planning and response efforts. Because this is a health crisis, while we hope it is unlikely, I believe it is our duty to be prepared for the possibility that the hospital could become overwhelmed with patients. And if that were to occur, having another site prepared for less critically ill patients, but those that still require hospital-level treatment, that is a best practice in these scenarios. The alternate care facility is not intended to treat COVID-19 patients, but rather to provide what is called surge capacity. So if the hospital is receiving more patients than it can house in their facility safely, this is, for intents and purposes, a last resort. We've been reviewing and eliminating sites close to the hospital for a couple of weeks, and it's important that the site be close to the hospital because patients and staff and equipment can easily be moved. I apologize for not involving your staff sooner in these planning stages. At the time, it seemed like a remote possibility, and we were quickly eliminating sites from being feasible as an option. But since that has occurred, Aldrich School kind of rose of the multiple sites under evaluation from both proximity, size, access, and having lunch space within it. The plan is to use the old gymnasium, the old lunchroom, and restroom facilities, and limited access for staff only to the kitchen. Access would be provided through the rear entry nearest on the south side. Thank you. Thank you very much. On the south side. So we do hope this is unlikely. But again, if we plan for the worst scenario, if Murphy's Law prevails, we will not need it. Any medical questions you have, clearly you have on the phone medical staff that are much more well-versed and certified to respond to those. But we believe that this is the best location nearest the hospital to put up into operation quickly. I can also assure you of the sanitization that would occur before any teachers or students or others would re-enter the space. And if there is a desire or a need for there to be time to get other supplies or items removed from the school to avoid interaction with patients, if the space was being utilized, I'm certain that we can work through those types of logistical issues. Part of our role in the Emergency Operations Center is to design these plans. And early in the process, a very early draft was sent to the Army Corps of Engineers, who are often involved in providing supplies and equipment to these ACF facilities. And I was very proud of our staff. Multiple sites were included as being under investigation in that preliminary report. But the data that we're using, the modeling that we're using, is all based on best practices. We aren't dreaming this up on the fly, although we are having to adjust and adapt very quickly. There are models that we are able to use and have used in this case to make sure that this is managed in the most efficient, effective, safe, and appropriate manner possible. So I'm happy to answer any questions. I know you have medical staff on the phone, but I do deeply appreciate your consideration for having this special meeting and being such a true and just a wonderful partner to the city. Thank you.
I would prefer to hear, well, does the board want to ask questions of Lori before hearing anything about the medical part of it? Would you prefer to hear the other part before we ask questions?
Lori answered the
Could you
questions
repeat
that I had from,
Excuse me,
that she could
I had a
answer.
hard time understanding what was just said. Could that be repeated, please?
Yes, Deb. So Lori's made her presentation. I didn't know if we have, who's on from the health system? Who's on the phone from the health system? Anybody? Jody? Jody, are you there?
It's Tim McKevitt. I can give a brief update from the health system if you think it's appropriate at this time.
Yeah, I think it would be appropriate. What do you think? Tim McKevitt. So Tim, why don't you talk from the hospital perspective, and then we'll ask questions at the end for everybody. Go ahead, Tim.
Great. On behalf of the health system and our 1,600 employees, I just want to extend a gratitude to Lori and the city staff and the Deputy Chief Murray. They've done a phenomenal job helping to plan for a worst-case scenario. To date, as of just about an hour ago, we've tested about 160 community members for the COVID-19 virus. We've had a total of 6 positives. 2 of those were inpatients. They were treated with the hydroxychloroquine and now are recovering nicely at home. We have 16 tests pending, and 135 were negative. It is, from the standpoint, our testing options right now are the state of Wisconsin or a reference lab. Literally within, by tomorrow, we'll be able to do in-house testing, which is a real benefit to our community. That we'll be able to screen patients on a limited basis, the most highly suspected cases. I'd be able to screen them to be able to either admit directly to our COVID unit or to discharge to the community. Right now, we've converted our old critical care unit, a wing of the hospital that has a capacity of 27 beds. The actual COVID unit itself is segregated. We do have ventilators for about 25 patients that we could treat, and currently we have 4 patients on the unit. You'd be just from a medical standpoint, the work that the staff is doing, our physicians and our nurses. We continue to have challenges, but we're holding our own as far as securing PPE, personal protective equipment, masks, gloves, gowns, and the medical supplies. We do have enough of the medication, the hydroxychloroquine to treat right now as it stands 40 patients, and we anticipate getting more of that. The team is doing a great job. We're keeping ourselves healthy here, and from the standpoint of the district considering Aldridge, the reason why it would work from our perspective better than other locations would be the proximity to the health system and the issues that Lori had mentioned. Having a pulmonologist here and an infectious disease doctor, it's an incredible asset for our community, but they're limited resources, so if they need to float between the 2 facilities and our other primary care physicians or a hospitalist or a specialist, having that close proximity to the health system would be much more efficient in a crisis situation. So we too appreciate, Jeff, I appreciate your leadership and commitment to the community, the board's commitment to the community. I know you work tireless hours for the benefit of our community, and we hope we appreciate your consideration of that location.
Thank you, Tim. So I'd like to open it up to the board to ask questions of Lori or Tim. Because we have people remotely, if Kyle and Wendy are okay, I'd like to let them go first. So I would go in this order, Stephanie, Pam, Megan, and then we'll come back to the Wendy and Kyle that are here. And obviously John is reclused himself and is not on the call. So Stephanie, you're first up. If you have questions of Tim or Lori, please proceed.
Yes, I do. Thank you. So I do believe that our schools should be open to the public for access. However, this is an extreme and different situation, something we've never obviously encountered before. So I did appreciate speaking to Lori earlier today. Tim, I think most of my questions really are going to you. I guess my first question is just I'm trying to understand the proximity issue. I'm just speaking, off the, just with a question. So I'm thinking of what I remember Aldridge looking like. I was summer school principal there a couple years ago. And I understand that it's important, the proximity to the hospital. How would that look, setting that up? And I guess that's 2 questions versus a hotel. To me, a hotel would make more sense because there's a bathroom right there. Can you just comment on that and how much further of a drive it would be to a hotel if we could secure one versus Aldridge?
I mean, from the proximity standpoint, I think you're asking why that's important. Am I phrasing that correctly?
Well, I understand why it's important, yes, but how many more minutes is it if we secured a hotel? What are we talking about in terms of it 5 minutes? Is it?
I'm sorry, Stephanie, I'm not sure which hotel are you referencing?
I don't know. Just I
Okay.
guess I'm thinking of the bank over on the east side by the freeway.
I don't know. I haven't driven it. It's longer, so I can't answer that. Truthfully, can't answer that question. It's longer. I don't know. I'm sorry, I can't answer that question.
Okay, and then the second part of that is, how do you actually see
Hold on,
setting
Tim and
Aldridge
Stephanie, hold on.
up? I'm
Lori
just
want-
trying to envision.
Stephanie.
We're talking 50 beds.
Stephanie,
There's communal bathrooms and communal showers, correct?
Stephanie, can you hold one second? Lori wants to answer your other question, if you're okay with that.
Sure.
Okay.
Yeah, go ahead, Lori.
Then when she's done, would you just repeat the question you just asked, okay?
Repeat the second part about how the building would be set up.
I'm sorry. So this is Lori Luther speaking. I wanted to respond in addition to the question about proximity. One of the key issues that we discovered when trying to determine whether or not a hotel might be feasible was the food preparation. And there are limited hotels in Beloit that provide full meal service, and the cost and feasibility of providing meals in those locations was questionable at best. So we discovered that even if we could secure rooms, we then had a completely different problem in trying to get food delivered for patients in those facilities when there wasn't a kitchen in order to do that, whereas the hospital has their own staff and they have their own food preparation, that if there's a kitchen available, they can reheat and distribute easily, and that became a hurdle in the hotels that we couldn't, address that particular concern.
Okay, that makes sense. Thank you, Lori. Tim, could you explain how Aldridge should be set up, how you'd use the facilities?
Sure. I think it probably would help from a standpoint of what our capacity in this building, sitting in the hospital, could be. And right now, we could probably fit in 125 to 150 patients if we had to, and that's we would be using our auditorium as a staging area as well, and that would be something similar that we would do at the Aldridge in an open area, setting up kind of a ward-like setting. For a ward-like setting, it would be cots or beds that would be in the open area. Having the shower facilities and the kitchen facilities for both the staff and the patients would be beneficial. One of the other sites that we looked at was the Shopko building, and that doesn't have that capability. So it would be in an open area, Stephanie, in a ward like 50 to 100 beds would be the ideal situation. I know there was a team that went over there today, and I have our Chief Nursing Officer, Sharon Cox, in the room, too, and I know she was on that visit. Do you want to talk, Sharon, a little bit about?
Yeah, from a healthcare perspective, to be able to have in such a pandemic or surge, having the ability to have a ward in this type of setting versus in a hotel where you may have separate rooms, logistically from a staffing perspective, it's easier to observe to see your patients. And just from a safety factor, it's better without your call light systems and the other technology that we currently use in-house. So being able to have that ward set up in that manner, it provides patient safety, it provides improved efficiencies for staff that would be being used in that type of setting.
And that makes sense. So with the gymnasium, there's 2 gymnasiums in Aldridge, correct? So we're referring to the newer gymnasium, correct, Kim?
No, actually, this is Lori Luther again, if I may. I was on that site visit today. And the intent would be to use the old gymnasium, which is immediately adjacent to the old lunchroom. And then there's a hallway to the south exit. So that south exit is where patients and staff would enter and exit. So it would be really secluded to that southern point of the building. The immediately adjacent restroom facilities and staff-only access to the kitchen facilities. The remainder of the building can be cordoned off, locked off, blocked off in any fashion you wish in order to really limit to that original part of the building, if you will.
Okay. And my other question at this time, thank you everybody for answering them, would be regarding technology. Will the hospital be bringing in their own laptops and whatnot?
Yes.
Okay. Thank you.
Thanks,
Thank
Stephanie.
you, Jeff. I'm good for now.
Okay, Pam, I think I have you next. Pam? Am I pronouncing it right?
Okay, I'm
Pam?
here. Sorry, I'm here. I had it muted. Jeff, you know, I'm with Stephanie. This isn't ideal. It's not something we want, but we have to help out. However, I did carefully read the letter from our attorney, and he addressed all of my concerns. So it's my understanding that we have to have some sort of a contract written up, and that there will be insurance provided by the health system, and everything else that he addressed, such as locking up all the classrooms and allowing students and teachers to get everything out of the building that they need. You know, those are my concerns. I don't want the kids to have things in the school that they can't get, like their instruments, books. If we send iPads home with them, they need to be able to get all of that. And the teachers, I think, should be able to make sure that they've got everything they need. And then as long as the areas that are used are restricted and everything is cleaned and disinfected at the end of all this, and we're not using the school for COVID patients, I think those are my main concerns. So we don't use it for COVID patients. We restrict access to certain areas only. All the classrooms are locked. There's insurance, and everything is back to the way it was at the beginning when this is all over.
Yeah, that's the intent, Pam, and we will have a written agreement done.
Jeff, are you speaking, Jeff?
I think so.
Okay, I know it's just whenever you speak, it's hard for me to hear. It's very muffled, and everyone else I can hear very clearly. So I don't know what's different.
I'm having the same problem, Jeff.
Well, Stephanie,
can't hear you for some
Stephanie, you
reason.
never can hear anything, so that's that. So, let me best back up. First, to get to your question, Pam, I talked to Lori. We'll have a written agreement on what's going to be done as far as what you just talked about. Sue handed me something here. It said that they did say they may have COVID-19 patients. Lori, you want to talk about that?
What I was trying to clarify is that I want to be very careful. That is not the intent. But there are people who are asymptomatic who carry the disease.
Of course.
And we cannot guarantee that, I can't guarantee that I don't have it right now. And I was in the building. So I just want to be very cautious and very open with the public about the fact that one of the great difficulties we have in dealing with this virus is that we believe that asymptomatic people are spreading it. So whether or not the intent is for COVID positive patients, which that is not the case, we would disinfect and treat the facility as though it had been, so that once we're ready to close shop and hopefully get back to some new sense of normal, that the space would be as cleansed and medically, ready to go as it can be. I just want to be a little cautious when we say no one with COVID-19 will be there, because we have serious inability to know that in every case.
Okay, and Lori, thank you for clarifying that. I understand that. I just know that a lot of parents are concerned, and I also know that the hospital would not be filling a gymnasium up with people that don't have contagious disease and then knowingly keep someone with COVID in there. So I understand that someone can be discovered to have COVID at any time, and there are asymptomatic people, but I just want to let the public understand that we're not intending to use it for anyone that is tested positive or suspected of having COVID. That's not the intent, correct?
That is correct from our standpoint, Pam.
Okay, because I understand the whole thing about, you could have it, I could have it, we don't know who has it. But once we know someone has it, Aldridge will not be the place where we say, let's have them stay. Okay. And then Jeff, the part about the agreement, I didn't understand what your response was there. We will have a written agreement, correct?
We'll have a written agreement, Pam, with who's doing what and what the responsibilities are.
And insurance and everything will be addressed in that.
Yeah, the liability, I know the health system takes the liability for the patient care. Tim, am I right on that?
Our responsibility would be any kind of malpractice and such for the patients or our staff.
Well, what about the kind of insurance that we have anyone who's using our facilities provide that, insurance for that if something else were to happen? Liability insurance, yeah, that's one thing, but are we going to have the same type of insurance provided that we always have for anyone who uses our facilities? That's my question.
Pam, I don't know to give you an answer at 100%. I'm assuming we do. I happen to know the people that have the insurance there, so I can check with them. I don't anticipate to be a problem with the liability part of it for the building and people coming in and out.
Okay. All right, thanks, Jeff.
Thank you. Megan?
No, I want to thank the city and the hospital. I mean, I think you put together a really outstanding plan, and I'm happy to be a community partner.
Now we're back to the real people. Who wants, Kyle or Wendy?
Ladies first.
Wendy?
Well, I have nothing in addition. I did speak with Lori earlier today, and she did answer any questions that I did have. And again, like Megan said, I'm glad that we can be community partners, the school district along with the city and the health system.
My questions have all pretty much been answered, but echoing a community concern, having COVID cases right here in Beloit is close to home, but then, when we're talking about using our school for a different way, it kind of brings even closer to home. So I think that making sure that staff members, I'm looking at it they need to do everything they can to make themselves feel safe and families, and just making sure that staff members have the ability to go in, remove anything they need to if they feel that need to, and then giving
I'm terribly sorry to interrupt. Is this Kyle?
Yeah, it's Kyle.
Yeah, it's a part here.
It's just very difficult to understand anything that's being said. I'm so sorry to interrupt. Is there anything that we can do?
I'm having the same problem.
No, I was just reiterating the fact that I think it's important. Is that better?
No.
Okay. For staff, administration to have a window of time where staff could remove anything they feel like they wanted to, and then reassure staff that classrooms will be kind of out of bounds and the building will be secure, even though we have people coming and going who normally wouldn't be.
I keep pushing the wrong buttons.
Keeping
Sue,
the voice if I can't hear, but I'm sorry.
I feel like we all need to
couldn't-
call in.
okay.
It's just I couldn't understand Wendy. I think it was Wendy.
It wasn't me.
You know what? It's hard to understand the people that are there speaking, except for we could hear Lori just fine. I wonder if board members should also call in and just have your phones out so we can hear you too.
In city council meetings, we've had to use, there were only 2 microphones.
Would that work, Michelle?
Went into where they heard.
Would you want to go to the mic?
Like have everybody present or absent to call into this Google number so we can all hear.
Can you hear me now?
Yes.
Yes?
Okay.
What did you do?
What I said was just reiterating the fact that staff members should have the opportunity, everything should be coordinated so they have a window of time to say if they remove anything from the building they feel that they need to. Okay.
I was at the building today with the folks that wanted to take a look at our facility, and we looked at where it's located, and we did ask that classrooms would not be used. And so we want to have a little caution that we don't want to open up our building to people coming in and getting things, because we just went through a week of, at every building, very carefully and systematically walking those
We
staff
can't hear you,
members.
Sue.
I'm sorry, walking our staff members into the building in a small window of time to get essential materials for instruction that are being used in our educational programming right now. And we just want to be very careful for everyone's health and safety that we don't have everyone just coming into the building because they want to use something right now. We have to be careful with that. It's a safety issue. There are certainly some areas that might be very close by this area that they would like to use, that there's an office real close by that it could be a service person's office. We saw a lot of things on that desk. That's one that would have to get relocated, and Sean would be on top of that. So we want to use some caution there. We are at the point of gathering all of the student devices out of the building, and the same with instruments. So we will facilitate all of that and wouldn't want individuals to have to do that. We're going to work on that. We also said we've got our copy center right over in that area, but we discussed that today with the team as well, and we would still be able to use our copy center because that's critical to our mass communications, and we would be able to access a different entrance for that. We would not interfere with what the health system needs to do, and we would not be putting anyone in an unsafe situation there. We did look at how the building could be blocked off for safety of everybody involved. I think that might be all I needed to share. Okay, thank you.
Pam and Steph and Megan, were you able to hear that or not?
Hardly.
It's
It's not a volume issue, it's breaking up.
Yeah. So what I heard you say, though, was there would be the copy center would still be accessible during this time if it was used as a hospital?
That's right, Stephanie.
Okay. Thank you.
Hi, this is Megan. I was not able to hear a whole lot, so my apologies, Sue. I think, though, I heard you say that in an orderly manner, although everything might not be accessible, we are going to make sure that people kind of are able to get what they need to get in some way, shape, or form. Or, you gave a really great plan Tuesday. That's still in effect?
Megan, that's an area we want to use extreme caution because they will not be using our classrooms, so we don't want to open our buildings up for people to come in and get a lot of items. We just finished this week doing every building with teachers being allowed a window of time to come in and get essential
Jeff,
items.
can I interrupt? This is Pam. We can't hear a thing. I feel like I'm wasting time being on this call because we can't hear anything. Is it possible that people could call in the same number we did, because it's clear as a bell for everyone who's phoned in?
Pam, can you hear this?
I can hear that, but if you keep going, it'll break up.
No, I moved over
Right.
to the microphone that Lori was at. So if we share this mic, and Sue will repeat herself. Is that what you're going to do, Sue? So if Megan, can you hear this? Stephanie, can you hear this?
Yes, I can. Just make sure you keep your social distancing.
We will. I'm going to
Well,
back away and
Sue,
let Sue come to the
I
microphone, so.
apologize. She probably addressed my question already, so I'm sorry. I heard about 20% of what you said. I'm so sorry.
Well, we want to make sure, though, so I'm going to let Sue stand here, and then I'll come back to the mic. So go ahead, Sue.
We just want to use caution on staff coming into the building. We don't want to alarm anyone. They have agreed that they will not be using our classrooms. That whole area will be blocked off, so people will not have to come in to get their belongings. We are looking at there's a desk that may have to be cleared off and relocated because it's in that area, but classrooms will not be affected. So right now, we've just completed the task of all buildings of going in with teachers in a small window of time to come in and get their essential instructional materials. And we just don't want to alarm teachers that they need to come and get their things out of the building. Those things will be protected. They will not be accessed by anyone. And we trust that. We are gathering all of the student devices at this time, and same with instruments. And we will look at being able to get those safely to those students. And that will all be happening in the next week. So we just don't want parents showing up or teachers trying to get things. We are truly trying to keep everyone safe in our practices.
Thank you, Sue. I heard something and I wasn't sure, and I appreciate you taking the time to clarify. You've already done such a great job explaining, so thank you. That sounds great.
Were there any other comments before we move on?
Jeff, I have one.
Go ahead, Pam.
In looking again at our legal advice and the discussion about the comprehensive agreement, will that come back to the board?
It can, yes.
Okay, I'm assuming that's going to be written before any of this takes place, correct?
No, I'm going to ask for approval, Pam, and with the idea that it will be presented to the board next week. I know the city wants to get started on this, so is that acceptable, Lori? We'll make it work. So, any other comments? I would like to say to those watching that this has not been an easy decision. There's been a lot of back and forth with the board internally. We take overseeing the school buildings seriously, but we also look at it as a taxpayer-supported entity, and this is a time that we've never been in our country. And if our community can't stand together, how are we going to overcome something like this? So we've had the city, the health system, and the district work together. So I'm comfortable where we're at, so I would welcome a motion to approve this.
Can I have one other question for Sue, please, Jeff?
Sure.
Okay, Sue, I'm wondering, I couldn't hear much of what you said, but what about students that have things in their lockers that they'd like to retrieve?
Pam, in response to that, we really feel that we are in a health crisis, and that item that might be in someone's locker, unless it is their device for educational programming or an instrument, which also would be a part of their instruction, that item will be safe in the room or in the locker, and we would not want to risk someone's health coming in to get something that isn't essential. Yeah, and actually, I think they've already been secured. Yeah, all locker materials and things have already been secured by Sean and his staff. We really would not entertain people coming into the building to get an item. We had that first week that if there were items that were absolutely essential for a child, like a wheelchair, what were some other items? Medications, inhalers, those things, we made sure we got those to those families. But if somebody has a jacket or some other things, they will be safe and they will be returned to them when we are all through this.
Okay.
All right. Ooh.
So I do apologize to the public that this is all new technology. We have been working through this issue for the last 3 weeks. We haven't quite found the right solution yet, but we will get there. So go ahead, Kyle.
I move that we approve the use of Aldrich Intermediate School as an alternative care facility.
There's been a motion by Kyle and a second by Wendy. Is there any other discussion? If not, I would ask all in favor say aye. Aye. Is there anybody opposed?
I can't,
Jeff, I couldn't hear the motion.
I couldn't hear what you said.
I couldn't hear the motion at all.
Well, they didn't hear the motion though. So why don't you come here to make the motion? Kyle will restate the motion and Wendy did second.
So I'm moving that we approve the use of Aldrich Intermediate as an alternative care facility.
Is there further discussion? Hearing none, I would ask all in favor say aye. Aye.
Aye.
Anybody opposed?
Aye.
That motion passes. Thank you to our guests for coming and sharing. Let's make this work, and we hope we don't have to use Aldridge, but it's better to be prepared in case we need to. So, and to the staff of the school district, thank you very much. You've been working 12-hour days on our own issues, and to take the time to do this on top of it, it's really incredible. So we will now need to reconnect with John Wong, and we will move on with our meeting. So thank you.
Thank you very much. Yeah, like to your point, Jeff, I hope we never have to use it. But thank you. Appreciate it.
Thank you, Sam.
Thank you.
Bye-bye.
Sure, I can run it from here, but I got to have my. I can get it. We got to.
Jeff, what else do we have on the agenda?
Is that you, Jen?
I'm waiting for John to get back on the phone. Pam, we only have the employment recommendations, the request for proposals, and the approval of the consent agenda. It's basically a consent agenda items, so it should be in your board docs.
Yeah, I didn't even look because I was planning on coming in. I think what everyone should do is dial in this number. We can hear each other just great.
I think
I
what,
agree.
I think what we have left.
Just dial it in to your cell phones.
Is John on the phone?
Yes, I am.
All right.
We would have no technical problems on this one if we all called in.
Hopefully the meeting will be over before we all got connected.
Pardon?
Hopefully the meeting would be over by the time we all got connected.
Yeah, I mean, Pam, all we have left on the agenda is the consent number 3. Can you understand that? That we have number 3 on the consent agenda? Kyle will make a motion, we'll be done.
All right.
Kyle?
I move approval of the consent agenda.
Wendy seconded. So on your agenda, on your board docs, it's 3. We have items A and B. I'm asking for approval of the consent agenda. It's been a motion by Kyle, seconded by Wendy. All in favor say aye. Aye. Anybody
Aye.
opposed?
Aye.
That motion passes. Future agenda items for discussion, send them to me. I've got an agenda already to Michelle. for next Tuesday. There will be a meeting next Tuesday, and I would take a motion to adjourn.
Did you say there will not be a meeting next Tuesday, or there will be?
There will be. It'll be a
Okay.
pretty full
I move
meeting.
we adjourn.
So Kyle made a motion to adjourn, Wendy seconded. All in favor, say aye. Aye. And to the public, we'll get this thing fixed yet. Thank you, everyone.
Everyone else has left the call.